Great. Well, I think we'll go ahead and get things kicked off. People may be joining us along the way, but I want to welcome you all to the COVID US State Policy-Based Database Virtual Launch event. We also call the database CUSP. And it's hosted today by Evidence for Action, which we call E for A. I am the Deputy Director. I'm Erin Hagan. And I will be moderating our conversation. I am joined by one of our grantees, Julia Raifman, who is the creator of the CUSP database. She's an assistant professor at the Boston University School of Public Health. I'm also joined by my colleague, Claire Gibbons at the Robert Wood Johnson Foundation. Claire's a senior program officer at the foundation. So welcome everyone. Will Raderman and Alexandra Skinner are also valued members of Dr. Raifman's team, and they're here with us as well. So good morning to all of you who are joining us, and good morning to my co-panelists. So today we're going to be talking about what you can do with the CUSP database, how it can be used, and from a research and a decision-making and a journalistic perspective. Before we get started, I just want to provide a little bit of background and context around Evidence for Action and the database, and a couple of quick housekeeping tips. So E4A is a national grant-making program of the Robert Wood Johnson Foundation. Our mission is to support research that can give decision makers the information that they need to implement policies and programs that will produce positive changes for the people that we serve. We do this by funding research, evaluating how interventions impact health, well-being, and equity. The CUSP database is a unique grant for us in that it is an infrastructure that facilitates the research being conducted that we usually focus on in our funding. But we really felt that the database was a timely and important tool, excuse me, that had significant potential to influence policy action around responses to the pandemic. And so that decision makers can learn from what is happening, what best practices are across the country. We hope that it facilitates rapid research and journalism, and that it will inform future pandemic responses, resiliency, and other social benefits. There are a variety of topics that can be evaluated using the database, which Julia will go into in more detail during her walkthrough this morning. But those include restaurant closures and reopenings, mask mandates, some of those traditional public health prevention strategies, as well as other economic security policies that were put in place in an attempt to help the economy rebound. Also, notably, the CUSP database, the data that is available there is, much of it is able to be disaggregated by race and ethnicity. So during our time today, Julia will provide a guided tour or walk us through the website. She'll demonstrate how to use the database, how to create graphs and other visual representations of the data, how to select which policies you want to focus on, download relevant data, et cetera. We will have a question and answer session, although you will be muted throughout. So I encourage you to type any questions you have at any point in time into the chat, and we'll collate those and get them to Julia towards the end of her overview. If you are interested in more in-depth conversations, we're happy to entertain those as follow-up discussions later on if we run out of time to cover everything today. So with that, I want to get us formally started, but first I want to turn it over to Claire to speak just a couple of minutes about RWJF's response to COVID, this database in particular. So thank you for joining us, Claire.
Hi, everyone. Good morning and good afternoon. Great to see all of you, or at least see your names. We've got other grantee organizations here, so that you probably know what I'm about to say, but for those of you who aren't super familiar with the Robert Wood Johnson Foundation, this RWJF is the nation's largest philanthropy focused on health. We work to ensure that everyone in America has a fair and just opportunity, and our main focus is on equity. We want to understand who experience barriers to health and why, what can be done to remove those barriers to ensure that people can thrive, And we want to understand what kinds of policies changes are needed to achieve equity. COVID-19 has really unleashed a dual threat to health equity in the United States, a pandemic that sickened millions and killed tens of thousands, and an economic that's resulted in tens of people losing their jobs. And the COVID pandemic really underscores that our health is inextricably linked to that of our neighbors and coworkers and childcare providers, delivery service people, among others, that our current public health and ecosystems do not adequately or equitably protect our well-being as a nation, and that every community is experiencing harm, though certain groups are suffering especially, and those include people of color and workers with low incomes, for example. So RWJF has actually developed a set of health equity principles for recovery from the pandemic, and I'll put the link for the chat if you want to check those out. And those recommendations and principles include recommendation to proactively identify and address existing policy gaps. And that's the recommendation behind funding this. States responded to the pandemic a wide range of policies that go beyond, stay-at-home orders and closing businesses, to policies that focus on housing, utilities, unemployment insurance, minimum wage changes, and on and on. These policies are incredibly important for relief from the effects of COVID, and they might have longer range implications as well. And we want to understand what the impact of these policy changes that has been during the pandemic and even beyond. So as Erin said, we funded this work through our Evidence for Action program, which is an ongoing research funding program of RWJF. And through E4A, RWJF funds research to understand how to achieve equity and a culture of health in the US. We've funded 63 grants since 2015, a wide range of important topics. And you can read those on our website, and I'll put the link to that in the chat as well. Again, thanks everyone for joining us. Really looking forward to this conversation and learning more about this database, Julia, and I'll turn it back to you, Erin.
Excellent. Thank you so much, Claire. Appreciate those comments. But without further ado, Julia, I will turn it over to you to walk us through the database, introduce your team a little bit more if you'd like, and share with us all of the capacity that you've developed.
Thank you, and thank you all for being here today. I would love to hear about the policies you're interested in the chat. If you want to drop those there, then I'll tailor this presentation to you. But I'll start out by introducing our team. I'm Julia Raifman. As Erin said, I'm an assistant professor at the Boston University School of Public Health. And I conduct research on how health and social policies drive population health and health disparities, with a big focus on infectious diseases like HIV and on mental health, and now, of course, on COVID-19. And when we saw the COVID-19 pandemic hitting, we knew that states would play a really important role in driving the response to both the COVID-19 pandemic and to the unemployment and crisis that was a result of the COVID pandemic. And so we have Alex Skinner, our database manager here today, and Will Riedemann, a research fellow here today, and I'll let them introduce themselves as well.
Hi, everyone. I'm Alex Skinner. I'm a research fellow at Boston University School of Public Health, and I'm the data manager of the CUSP team, as Julia mentioned. So I help coordinate our team of student volunteers who collect our policy data, and we also work to review older policy data just to make sure that it's accurate and up to date. I've also led some of the efforts to expand our database into new policy areas, such as the vaccine distribution, which we started collecting earlier this year. And then my research with the CUSP data is primarily focused on improving standards for data collection and reporting by race and ethnicity, both at the federal and the state levels, and also some work to advocate for equitable COVID-19 vaccine distribution.
Hi, everyone. I'm Will. I'm the other research fellow on the team. Some of the bigger collections that I've been a part of have to do with unemployment insurance, and then some of the reopenings and reclosures of different kinds of businesses across the country based on the state that someone might live in. In terms of unemployment insurance in particular, we've found that that's one of the more important policy areas during the pandemic, considering how much job loss has occurred and the need to actually guarantee as much income as possible to those individuals. So if you're interested in information related to those policies by state, specifically who's actually eligible, how long you can remain eligible for, and then the amount of funding that you can actually receive through those programs. We've got a lot of that information, not just for the regular unemployment insurance programs, but when you factor in some of the federal programs as well, some of which have expired at different times, but we've got that information, as well as some of the timing for extended benefits. So it should all be helpful for health and economic analysis for projects you're looking to work on.
Thanks so much, Alex and Will. And as you can tell, they really lead a lot of the meat of the database, and really fortunate to have them leading this work and here today to answer questions that you may have. The focus of our database is really to help facilitate rapid response research and journalism. We know that the need for rapid response research and journalism still, even a year in, is much bigger than any one team can do, and we really aim to democratize it and make it accessible to people as much as possible. So we welcome ideas of additional policies that we can add to the database that you think are important for your populations. We also are happy to share our data anywhere and everywhere. Really, we aim to help policymakers help people as much as possible. And we also have a big focus on equity. We can see that the COVID pandemic, because of structural policies and structural racism that had already shaped such large inequities in our society, we see that the COVID pandemic is actually really exacerbating those disparities. And we see the response policies play a really important role. So we watched in real time as states went from including essential workers in their top priorities to many of them dropping them down in favor of age-based priorities instead. And that has very important implications for equity and who is vaccinated for against COVID and who continues to die of COVID. Similarly, we have learned that unemployment insurance actually excludes more people than it includes. And some of the federal actions have expanded unemployment insurance during the pandemic. But even so, we see that many people still aren't receiving unemployment insurance, and that the amount of unemployment insurance really varies enormously from state to state, from $235 in Mississippi to $800 a week in Massachusetts. And then the federal supplement, like the $600 CARES Act supplement, take on great importance in that context for people who do need unemployment insurance. And with so many people vulnerable to food and housing insecurity during the pandemic, and because of the wealth inequities that characterize the US population, we also see that policies that specifically counter those or that don't counter those take on a lot of importance. So a lot of states chose to freeze evictions at the beginning of the pandemic, but a lot of states have chosen to continue evictions at this point. And the CDC eviction moratorium has not been strong enough to prevent many evictions. So that's a policy decision that is exacerbating disparities. And we try to really highlight on our website, we have some areas where we describe the specific policies and some of the research and journalism that we've noticed. And I think, first of all, we're just really glad that you all are doing the work that you're doing at think tanks and as journalists, because the work that you do is really important for shaping the narrative and helping us all understand what's important and what we need to be doing. And there have been some important stories about how hard it is for a child to try to learn in Zoom school if they fear that every knock on their door could be them getting permanently kicked out of their home, or if they don't have enough food to eat. So we've also tried to provide a lot of data on pandemic EBT and the expansion of food security programs for children, as well as SNAP, as there have been some more expansions to that. And as I said, we're always glad to add more policies. Just last week, we heard from a researcher interested in pandemic EBT, and and Alex led us in updating the 2021 pandemic EBT data. So with that, I can turn over to the website. But please do, if you see specific policies that you're interested in, please do just drop them in the chat, and I'm happy to talk about them in more depth. All right. Of course, now I've lost the chat, but maybe one of the colleagues on the phone with me can highlight if there are any policies that are highlighted over there. All right, so this is our website, which we're really excited by. We worked with the team at Zero Defect Design to create it. And as you can see, we really leaned into our love of data and the graphs. So I'll start there. We have tried to make it really easy to parse some of the policies that are most important right now and for which there's increasing evidence of how important they are. So I think there are a few policies that are starting to have a lot of evidence that they're very effective for COVID prevention. So of course, the most effective approach to COVID prevention is to vaccinate people. But state policies really shape a lot of who is vaccinated. And I think those priorities at the beginning, that really communicates to people that a lot of excitement around vaccinating them and setting a priority for them and making it accessible to them. And I think who was in the phase 1A, 1B, like that made a big difference. And now as we work to vaccinate the whole population, a lot of times it's the whole population that will be eligible, but there are some groups that really have not had a lot of protected time to get vaccinated before everybody gets in line. So for instance, we can look at grocery store workers. I have loved some of the coverage of grocery store workers and how they felt really left behind by vaccine priorities in a lot of states. And here you can see that we've depicted here the ACIP, the CDC's Advisory Committee on Immunization Priorities recommended grocery store workers be prioritized in phase 1B. But then you can see several states moved grocery store workers back to later groups. And so it wasn't possible for them to be vaccinated, even though grocery store workers, oftentimes have contact with hundreds of people an hour and in closed indoor spaces. And they may live in a state where there's a mask order and their customers wear masks, or they may live in a state where there is not a mask order in place. And then here you can see adults age 65 plus. ACIP initially recommended prioritizing 65 plus in 1C when this full panel of experts considered ethical and equitable vaccine priorities. But then the federal government made a recommendation to move people 65 plus up to an earlier vaccination stage. And you can see that most states responded. So that's another important point we take from the database, that federal guidance to states, especially in this really busy context where there are many decisions to be made, and not everyone may be an expert in parsing the evidence, and there's a lot of evidence to keep up with. The guidelines that federal government puts out there on what states should do is very important, plays a very important coordinating role. Okay, I'm able to see the chat now, let's see. Okay, great. And then you can play around with this. You can also download the data, and I can attest the best testament to how well our website designers have designed this website is that this is where I go to download our data. We have our old Google Sheet, which is a little bit more funky, and which is exactly why we decided to design a website, and are grateful to RWJF for supporting us in doing so. And this is certainly easier to parse. And I'll come back to the graphs. Let me just show you, what it looks like if you want to go see those data. You can certainly click over from that CSV, but this is the table that you'll get when you download. So this is every state and all of the vaccine priority groups listed by ACIP. And here you can see. And then we also added people who are incarcerated because ACIP actually did not include people who are incarcerated in their priorities, even though they are at very high risk of COVID cases and deaths. And so we added them here. And then you can download this and you get it as an Excel file, and you can start playing with the data. So I think, for instance, one variable that we've been looking at a lot is whether essential workers were prioritized before or after adults 65 plus, or whether grocery store workers, like a specific type of essential worker, was prioritized before or after 65 plus. Because a lot of people who are 65 plus can safely stay home, whereas grocery store workers are having high contact. And we do see that in essential occupations, there are high deaths as well as cases among people in middle age, and that there are huge racial disparities. All right, so maybe with that, we'll go back over to graphs. And then some of the other policies that have been emerging as particularly impactful, and for which there's a good deal of evidence now that they are associated with reduced cases and deaths, are face mask mandates, restaurant and bar closures and reopenings, and interstate travel quarantines. So for instance, we can look at face mask mandates. The landing page is the weekly cases or deaths per 100,000 people across the United States. And then here you can do a drop down. So let's see, let's look at Pennsylvania. So here, Pennsylvania, you can see they implement their public face mask mandate. And then you can also look at the data by race and ethnicity, thanks to the COVID racial data tracker from the Atlantic and the Center for Anti-Racist Research. And again, what we see is that Latinx people had much higher cases, as did Black people, especially in these earlier waves, relative to white people. You can also see that not every group is depicted here. We see that, that a lot of data on Native American people are missing. And that is really unfortunate, particularly given that Native American people, where we do have data, were far more likely to die of COVID and at young ages. Okay, and then let's see, I'll go back to our graphs page. Restaurant and bar closures and reopenings, and we can look at Pennsylvania again. And here you can see that the black line is Pennsylvania and the lighter line is the United States. And you can see here, Pennsylvania closes restaurants and there's a decline after they close restaurants. And then they start to have an uptick and then they reopen restaurants as they're having that uptick. And then things go down. And then you can see the comparison in the United States. And then here we can go back to the data library just to see how would you download and use these data. So here we have closures and reopenings. You can see the dates that several different types of businesses were closed and reopened. We didn't graph all of these because it really seemed the restaurants and bars, which are settings where people are often taking off their masks to eat or to drink, seem to be a bigger source of transmission based on initial policy studies. Although gyms also seem to have some outbreaks in them. And then here you can see several different policies. We've also tracked alcohol and firearms policies and whether states left open those kinds of businesses and allowed restaurants to deliver alcohol during the pandemic, which is, I think is, we see mental distress just skyrocketing for the whole population, especially at the beginning of the pandemic. And whether people were turning to alcohol to cope with that distress has really important implications for themselves and for family members and interpersonal relationships and potentially things like domestic violence, as well as suicide. And that is a lot of why we tracked firearm sellers as well. And these are 0-1 variables. So when you download them, it'll be a 0 or 1 for did they leave firearm sellers open, and you can see that most states did leave firearm sales open. And firearms are an enormous suicide death risk. Here you can see some of the policies we have on unemployment insurance, food insecurity, housing, and utilities. And I see we have several people here focused on housing, so I'll go over there. We have really worked closely with Emily Benfer's team to track these policies. So they have a whole legal database that has, I don't know what the running count is now, somewhere between 50 and 100 different aspects of the eviction policies documented. So they are really the leading experts on this topic. The way they have documented them is in a format that's ideal for lawyers. And so what we sought to do was to make it easy for journalists or researchers to pair these data with population health data or other outcomes data. So for instance, like the census pulse data has information on whether people fear eviction. And a lot of what we do is kind of code this before or after. So we'll say it's coded as a 0 before a policy was in place, then a 1 if the date is between these two, the start and end date of the eviction moratorium, and then a 0 again afterward. And I'm happy to show some graphs on what that looks like. But I think a lot of times what we see is that we'll see data on COVID cases and deaths, and we'll see data on disparities, but they're devoid of this kind of policy structural context. And that is so much of what shapes disparities and so much of what is driving the pandemic based on initial evidence. So I think that is a lot of the motivation behind this database. And we try to make it as easy as possible for everyone to access these data. We're also happy to be in touch about how to code them. But for instance, I was in touch with some Vox reporters who reported on how the pandemic has changed over the course of time and who's getting infected is changing. But I think something you could add to something like that, rather than just looking at time or just looking at age groups, you could also say, well, what has happened in states that had mask orders in place the whole time versus states that didn't ever have a mask order. And so I think adding some of that context helps us understand, well, why was there such a big outbreak in a certain state? Here, we recently used these data on minimum wage. And we linked this with data on food insufficiency during the pandemic from the Census Pulse survey. And this kind of thing is really powerful. I think these are such big driving forces behind what's happening to people, especially the people who are most affected by economic precarity during the pandemic, that you can really see the impact pretty quickly. So here I actually have pulled up this chart from the Century Foundation. This is the average weekly state unemployment insurance benefit and the percent of state claimants who are Black. So this is the kind of chart where, they are just associations, but I think it's helpful to look at associations in this context. It's helpful to do some descriptive work that then researchers may build on with more detail. But it's helpful to see, well, it looks like the states that have more claimants who are Black have lower unemployment insurance benefits. And how does that inform policy? Why is there such variation in unemployment insurance across states? And is that something that we may want to consider revising in our policy process? Okay, I see a question. Thank you, Joyce, for your question. Can you make charts or lists by combining data? If you want to know which states put grocery workers at a lower priority and also had face masks. Yeah, so we have tried to make it easy to merge the data. So one thing you could do is simply download the Excel files for both of those and put them next to each other. But let's see. If you download the CSV, it will have, I'm just checking. So yeah, it has the state. It also has the state abbreviation and it has the state FIPS code. And it will be in the same order for every chart that you download. And so we've tried to make it really easy to link these data with other data sets because it will vary whether they have the long state name or the state abbreviation or the FIPS code. And we've tried to make it really simple. We're also happy to help. Alex worked closely on with the journalists who did this story to create this graph, and we did a lot of back and forth. This is a graph depicting when higher education employees were prioritized for vaccination early. This was before there were several changes to the ASAP after there was a guidance to do age-based vaccination. But we did a lot of back and forth to make sure that this graph was correct. I will also say, let me tell you a little bit about how we collect our data. And we always try to make our data as accurate as possible, but we also recommend anytime you can trying to check it against another source. Because a lot of times it's what we were able to find through looking at government policy websites. But we get emails from people using the data or people who live in different states, and we find them so helpful for saying, you know, is that really true that Utah had a mask mandate that was for everyone, and then they ended that and only had one for people who were essential workers? It's really helpful for us to dig into those details and make sure that we've coded it correctly, and also to update our code book to say, well, this is how we made this policy decision, this policy coding decision, and you may have a different coding decision that you want to make. Maybe you don't want to just have mask mandates, but there are some states that sort of suggested masks instead of mandating them, and maybe that's right for the work that you're doing. So yeah, you can certainly download both data sets. And then just to tell you about how we collect the data, we search government websites for executive orders and directives pertaining to specific policies. We also, when we can't find a government order, that's the hardest to confirm, right? Is like confirming the zero that there was no policy change. So we also look for media coverage if we can't find an executive order. We try to compare to complementary tracking efforts. If we can find that through a media organization like those that you work at, or nonprofit organizations. We double check each state and state with no policy changes again with an independent coder. And we post the publicly available database now housed here with comments on our coding decisions. And then we invite comments and try to be iterative. So I know for this article, you know, there are people who write in and say, well, how did you decide to code my state where it is? And we had to clarify, we decided to code the first time that anybody who worked in higher education was eligible for a vaccine, not when all higher education employees were eligible for a vaccine. And so we just have to make coding decisions so that we have a straightforward way of presenting the data. But we also try to provide the raw documentation so that other people can code the data as is right for you. And so here we have actually provided all of the documentation for all of the policies. These are just links to Dropbox folders where you can find images of things like the stay-at-home orders. And this is interesting from a qualitative perspective, that these really differ a lot in the kind of language that they use, saying like, this will be over next week, don't worry about it, or like, it's very serious and you should stay home. Okay, and then maybe I'll show a few more examples of how people have used policy data. All right, so we did those. One of the best uses, I think, is to pair it with something like the Census Pulse data, especially because these data are representative by state. And I'm so grateful to the Urban Institute for compiling all of these data in one place. So this is really easy to use. And you can download, this is just updated through January, but this is a place where you can get phase 1 and phase 2 of the Census Pulse to have a lot of those temporal data. So we do a lot of looking at what happened before and after policies were passed. This is some writing that our team did, and a map that Alex created, depicting which states were reporting testing cases, hospitalizations, and deaths for Native American people. And you can see that this was as late as October 2020. So that's some of the work we've been doing. And then we have also linked it and used the questions to sort of inspire work with the Understanding America study data. This is a nationally representative data set rather than state representative, but it's pointed us to some of the most important questions. And here, it just takes a couple of days to register for access for these data. If you go to data, we click on the national survey data, and you can access those collected bi-weekly since the beginning of the pandemic here. And similarly, Census Pulse data are collected weekly at first and then bi-weekly. And then let's see, I think let me pause and see if there are any specific questions, and then I can show you some other work that we've done with the data. Oh, there's a question about how often the database is updated. Sorry, let me go back into sharing my screen for that. So we don't update all of the policies all of the time. What we do is we try to keep the most relevant policies updated and to be really clear about when we last updated the data. So Here you can see the data. The last comprehensive review of vaccine distribution was March 3rd, 2021. And that's listed at the top of that table. So you can see that. Some of the other policies like stay-at-home orders, which haven't really been put in place since early in the pandemic, we don't update those. Or we were updating pandemic EBT for 2020 through July, and then in August, the last date to implement the policy, came up with their pandemic EBT plan. So we just recently updated that when we ended the 2021 data. But we always try to clearly communicate this. We also are, as I just said, with the pandemic EBT data, this database is really designed to help inform the world. And so if there's something that you think is an important policy right now, we will add it. So just let us know. And if you want to create beautiful graphs depicting some of these data on your website, you could use our graph, or you can create your own. And we really, the aim is to get it out there and to make it useful. And so we do our best to do that, but we know that you do a better job of that. So we are glad to work together to do that.
Julia, we have an additional question about, do we have the dates that each phase opened up in each state? So I'm happy to answer that or turn it back over to you.
Yeah, sure. Yeah, why don't you answer that, as you know those data best?
Sure. So I assume we're talking about the vaccine phases here. Right now, we've just listed when, or the phase that each state is moving to, and we don't have that across the calendar year yet. But we are picking some select groups of people that we think are particularly important. So like older adults, essential workers, and then we do have a list together of when vaccines will be available in each state to the general public. And we're in the process of double checking that data. So it's not yet publicly available, but it is something that we're thinking about and hope to release soon.
Yeah, and I'll say that equity will continue to be really important there. And I think we'll think about, and we would love to hear from you too, if you think there are ways we can add policies that track whether states are really specifically considering equity. But the policy decision will be to make everyone able to access the vaccine, like technically eligible, but whether people can actually access it will be a matter of a lot more than that. It'll be a matter of the supply in their area, and can they safely get to a vaccine appointment, or do they have to expose themselves to COVID to get to the vaccine appointment? Is it going to workplaces? Is it going to communities that have active, really large outbreaks, like in Detroit? Like those are a lot of the questions that that will continue to shape equity as there's this decision to open up. And I think the timing of when states open up, and whether there's a little bit longer when, like Massachusetts now has grocery store workers eligible for the vaccine, but now there is a big group added today of people who have one health condition, and then there will be the whole population added on April 19th. So whether grocery store workers have actually been able to get the vaccine in that time is really dependent on how long they had access to it between these bigger population groups. And then I can show you some other ways that we've used the data, if that's helpful. Let me give a minute for any other questions in the chat. Okay, here we go. This just has a few figures. So some of this we've kind of talked about. Let me make this a full presentation. Here we go. I think I shared at the beginning that we think about how policies shape health. But a lot of what we see in public health and in data sets in general is that they have a lot of information on one population and on the risk factors that the people within the population experience, and information on how maybe we shift, who's up here, who's at the most risk for high blood pressure, or who's at the most risk for COVID infection, and thinking about, how do we shift people from here to here. The perspective that this piece that rose sick individuals and sick populations, which is from a few decades ago now, the perspective that this piece brings is that we should be looking at exposures that affect the whole population. So he uses the example of, people in Kenya have blood pressure that's just a completely different distribution than people in Framingham, Massachusetts. and what are the forces that are driving the whole distribution to be lower rather than driving people to go from here to here or from here to here. And so that's a lot of how we think about the work that we're doing with the COVID database, is thinking about what is shifting the whole population. And a lot of it is, why is the Black population here? And why is the Latinx population here? And why is the Native American population here? And the white population is here? And what are the policies that are shaping those different distributions? And how can we move this whole distribution so that it's in a better place, a healthier place? So we talked through the data collection process. That's the same as we have on the website. And I talked through triangulating policy data with other sources. This is some of the research that our team has done with the data, and I'll share research from our team and other teams, but this is work led by Kate Leifheit, who found that, who looked at when eviction freezes were lifted. There was so much going on at the beginning of the pandemic when eviction freezes were put in place that we decided to focus on the period after things had steadied out a little bit. And here you can see that leading up to the eviction freezes being lifted, that there was not much of a temporal change in the incidence rate ratio or the mortality rate ratio. But then after the eviction freezes were lifted, there's this big increase in COVID cases and in deaths. There's actually a bigger increase in deaths than in cases. And I think what that might reveal is that people who are particularly vulnerable to COVID-19 may be most affected by these policies. And it may mean that the people who knew they were vulnerable had to go back out in the world and go into unsafe conditions, or had to go into other unsafe housing conditions or unsafe working conditions, and expose themselves to COVID on either of those, so that they could continue to have enough food to eat now that they were at risk of being kicked out of their homes. This is work by other researchers where they looked at the time leading up to state mask policies and what happened to COVID cases after states implemented mask policies. And here you can see there's a decline, and the decline follows the pattern of COVID, and it's exponential. This is some work. I wish this graph were everywhere, but it's hardly anywhere. It's work that Mary Bassett first highlighted in PLOS Medicine over in her article over the summer and published, I believe, in the fall. But she really highlighted age-specific disparities in COVID-19. And here you can see that when you adjust for age, which is really important because Black and Latinx and Native American people tend to be younger than people who are white and Asian, then you can see that that young people who are Black and Latinx and Native American are 5 to 15 times more likely to die of COVID-19 between 35 and 44, 4 to 8 times more likely to die between 45 and 54, and 3 to 5 times more likely to die between 55 and 64. And a lot of this is likely due to exposure as essential workers, but none of these people are eligible for vaccines under age 65 plus vaccine thresholds. So we've all seen this graph, right, that shows like the risk by age, but this is not a graph that's available on the CDC website. It's not data that are easy to find in general. The CDC data that do have, that do provide this information are missing half the values. And so, but the best information we have suggests that Black, Latinx, and Native American people 55 to 64 are actually more likely to die than 65 to 74-year-olds who are white or Asian. And so this is where vaccine priorities really affect people. And I'll also say, like, these people in middle age, like, they would have lived decades longer if they hadn't died of COVID-19. And many of them have children. So many of them are essential workers whose children may have been orphaned by COVID. Vaccine priorities also affect this because 30% of the full population is Black and Latinx, but just 18% of the population that's 65 and older is Black and Latinx. And so vaccine priorities, when they prioritize 65 plus, that's by design saying Black and Latinx people will be less likely to get the vaccine. So when we see that Kaiser Family Foundation in their most recent report finds that that Black people, I think, were 1.75 times less likely to be vaccinated than white people, and Latinx people were half as likely to be vaccinated relative to white people. That this is by design, is based on the policies. Plus all of the access issues on top of that. There have been nice articles about how even when people have been prioritized for the vaccine, you need to provide websites in languages that they can speak. And there's, it was interesting to watch on Twitter, like even the New York Times journalists covering vaccines needed help to navigate the website to figure out how one should sign up for a vaccine. And if she needs help, then certainly the people who are working full-time jobs as essential workers and may not have the same network that she has, they may need more help signing up for vaccinations. And this is some of our work on economic policies. And so we looked at minimum wage. This is adjusting for several other covariates. But this is state minimum wage and food insufficiency. And we looked at $2 increments. And most states have the federal minimum wage of $7.25 an hour, about half of states. And then other states have increased their minimum wage to these higher levels. And what we saw was there was like that $12 an hour really seemed to be associated with a pretty significant decrease in food insufficiency during the pandemic. And then we found very similar results when we used $1 increments. But I think these graphs are actually particularly interesting for this group. Here, I'll go to this one. These graphs are just what we see descriptively. So you can see a lot of the association that we saw when we adjusted for everything. You can see that just by linking the census pulse data on food insufficiency with the state minimum wage, and that's $12 or more an hour. And I was mentioning that these policies really do a lot to shape disparities. And here you can see that for Black people, they were much more likely to report food insufficiency in general. But then when there was this $12 minimum wage, that was associated with a larger decline in food insufficiency among Black people. And it was associated with a decline in food insufficiency overall. So this is the kind of analysis that you can do. You can go link to the minimum wage data. You can cut it into $1 increments or $2 increments, or as you like, and you can start to look at how is it shaping people's experiences during the pandemic, and how is it shaping the experiences of Black and Latinx and Native American people who've been particularly affected by so many aspects of the pandemic. Let's see, and I think, maybe I'll end with this one and then come back to the group for more questions. Here we looked, this was an analysis inspired by our work on unemployment insurance. And here we looked at what happened to people who did and didn't receive unemployment insurance, since so many people weren't even receiving it. And we found that when people did receive unemployment insurance, that it was associated with a reduction in food insecurity. And then here we did this study during the period when the CARES Act supplement of $600 a week ended. And so we think that's why there's it goes back up here. And we did see that, that when people were reported receiving more unemployment insurance each week, it was associated with a greater decline in food insecurity. And then we actually were able to look specifically at when people were receiving the CARES Act supplement and when they weren't. And there was a greater decline in food insecurity when people were receiving unemployment insurance with the CARES Act supplement. And there, let me just take us back to our website, because I think Will mentioned he's been working on those data, and I think that it's definitely one of the strongest elements of our data set is, I think one of the big lessons of the pandemic is that public health researchers and economists need to come together in our work in thinking about, how do we design an optimal policy to protect people from COVID-19 and protect people from economic precarity, as well as in thinking just about how do these economic policies affect people's day-to-day well-being. And here is the data library, so unemployment insurance. And here you can see those numbers I mentioned, the weekly unemployment insurance maximum for every state and how much it varies from state to state. And we wrote up some of our thoughts about unemployment insurance and how it excludes many people. The benefits are brief, and the benefit size is small relative to other countries. We wrote up some of what we learned through this tracking process in the Incidental Economist. In here, I can drop this link in the chat as I exit and come look at all of you. Are there any other questions I can answer? I'm excited to see several people from Nacho. So I think if there are ideas about how we may work together, support the important work you're doing, we would be excited by that. And similarly on housing, I see a lot of people here working on housing.
Julia, while we're waiting to see if people have other questions they want to pose to you, I wonder if you can talk a little bit about whether any of your analyses that you've done with the database have been surprising to you. Were there any things that as we all work in social determinants, and I think have seen research and come to expect that more generous social benefit policies do improve people's health and well-being. So just wondering if your analyses have aligned with your expectations, or if there's any surprises you found along the way.
Yeah, thank you. That's a great question. And I think there are probably two things. I've been surprised that the federal government has not provided more guidance. We tracked, something like 20 different physical distancing and COVID prevention policies, but we also saw a lot of evidence that some of these policies are very effective, vaccinating people, and specifically, I think vaccinating those most exposed and most likely to die from COVID, mask orders, and we see growing evidence even from the CDC that restaurant indoor dining closures are pretty important for COVID prevention. And so I was surprised that, certainly it's not up to the CDC to put in place these policies, but I think it would be very helpful to provide guidance on which policies are most effective. And I hope we won't need these policies after so much of the population is vaccinated, but so much of the world population won't be vaccinated, and it's quite possible that there will be a variant and we'll need to go through another vaccination campaign. And it's really important to have pretty clear-cut, simple information from the federal government on the approaches to take. And we see how impactful it is when the federal government does provide guidance, when they provided the guidance to vaccinate based on age thresholds, and then later when they provided the recommendation to vaccinate teachers. We saw a lot of states change their policies because of what the federal government suggested. I think another surprise, maybe not a surprise, but a pattern that we were able to see by tracking several social policies at once was these policies of exclusion. So we saw that when states had minimum wage, some people were systematically excluded, people who are independent contractors, or people who are getting tipped minimum wage, systematically excluded, and they tend to be people who are Black and Latinx and Native American who are excluded. We saw the same thing for paid sick leave. Most states do not have paid sick leave, and the CARES Act provision was not very strong to support more employers in creating paid sick leave. But what we saw when there was paid sick leave, it tends to apply to people who have full-time jobs, who are not independent contractors or gig workers. So again, people are excluded from paid sick leave. And then people are excluded from unemployment insurance. The same people, the independent contractors, the part-time workers, people who earned too little. I was really surprised when Will led us in learning that you could be excluded from receiving unemployment insurance because you earned too little money in the prior year. And that exclusion is really going to disproportionately affect Black and Latinx and Native American people who already experience so many disparities in economic precarity and wealth. So I think we really saw these policies of exclusion emerge as a theme.
Yeah, and so picking up on the points that you've been making throughout about the equity implications and for the differential impact for people who are most vulnerable, I wonder if you've seen anything that has been especially beneficial or more promising in terms of what is working to potentially close those disparities, or really to address in a beneficial way the people who have been most impacted.
Yeah, that is a really nice question. And I really like the idea of focusing on an optimistic note. And I think there are a couple of things that have been really wonderful to see. I think we see how policies, the modern day policies like those I just mentioned, plus historical policies like slavery and Jim Crow and redlining have shaped just huge disparities. Like prior to the pandemic, Black people had 1/8 the wealth of white people in this country in 2019, according to median wealth. And we saw all of these policies that that were exacerbating that, but then we also saw that the most recent stimulus bill included this provision to do the child income tax credits. So a lot of the way that the wealth inequities are transmitted is through inheritance that really affects kids, and they're born into these really big differences in wealth and economic standing that can affect their housing and food insecurity. Kids have been more likely to experience food and housing insecurity, like households with children. That's a big risk factor for food and housing insecurity during the pandemic. So it was really wonderful to see the government put funds toward and invest in children at this time when they're really vulnerable to experiencing these inequities and really need it. And I think it'll be really important to see further research on how those tax credits affect those kids, affect their learning and their ability to invest in human capital and close those gaps in the future, because I think that's something we should be really worried about. The kids who are experiencing food and housing insecurity can't learn and young adults can't get good jobs and are experiencing very high unemployment. And that should be a big policy focus going forward. One of the other policies I really liked, I'm excited by anything that really champions like frontline workers who experienced this mix of the worst COVID and the worst food and housing insecurity during the pandemic. And so I was excited by the policy proposal from Michigan to do to send essential workers to college for free, like a GI Bill for essential workers. So I really liked that consideration. I hope we may see more states consider that kind of approach.
Great, thank you. So I know we're getting close on the end of our time. I want to thank you, Julia and Alex and Will, for all your work on the database, for your presentation this morning. I think I want to let people know that if you want to have further conversation with Julia or with anyone from Evidence for Action or our WJF, you can reach out to us. There's information in the chat about how to get in touch with us. But Julia, I think I'll give you the last word. And I was going to pose a question that is related to the one that that was posed by Lori in the chat about, so I was going to ask sort of what do you hope is achieved with this database? Since you and I work closely together, I know the answer to that question is that it's influencing positive policy going forward. So if you can just sign us off by sharing a little bit about how people can best use the database for that purpose. How can they share it with their policymakers and decision makers? How can they best help to disseminate the database and all its uses?
Yeah, thank you. What a wonderful question. And thank you all again for being here. Certainly share the website with your teams, but we really love for people to get in touch. We're happy to help navigate the use of the database and use of the policy data. We've made the whole database really downloadable on GitHub if you want to mix and match policies that way, or if you want to look at them one by one. We hope that the data tables are easy. And if you see ways to for us to make the website easier to use, you can tell already that we love feedback, and that's our goal, is to facilitate your work, facilitate the work of researchers. And we're excited, that the number of publications based on the data continues to grow, but we think there's a lot of work to do. The policies will shape it, and this is a big policy moment, right? Like a lot of the responses to the pandemic are going to happen right now, and a lot of what shapes the future is going to happen right now. So I think this is the time to dive in.
Thanks so much, Julia. The website is accessible through the Evidence for Action website and through and I'm sure Julia's dropping the link right now. Steph just dropped the link into the chat here as well. So thank you all for joining us. Please feel free to be in touch, and thank you for helping to share this important work. Take care.
Thank you.